Welcome to Section 1 of the HCIPP Cert Prep course, Introduction to the Healthcare Domain. In this video, we'll be looking at the key aspects and challenges of the healthcare domain. Healthcare is critical for the well-being of societies. However, it is a very diverse and complex domain as it integrates a wide range of organizations with different roles, procedures, and objectives, but all with patient data to manage and protect. Quality and efficiency of healthcare procedures are key to successful outcomes, and technologies such as electronic health records, mobile applications, wearables and sensors that monitor patient data 24/7, or even cloud computer or artificial intelligence help achieving those key goals. With digital health, there are a lot of opportunities to improve and optimize healthcare procedures, but this can also integrate a lot of risks and vulnerabilities. A healthcare cybersecurity specialist needs to have the knowledge and skills to protect health data in both digital and hard copy formats. When we talk about healthcare organizations, we can have a wide range of options. We can talk about ones that directly provide services to the patients, such as hospitals, clinics, laboratories, ambulatory treatments, and even hospices and nursing homes. Or also about organizations that indirectly affect people's health, such as patients' organizations, research and education institutions, pharmaceutical companies, or companies that develop medical devices, or even health insurance companies, which support billing and payment for healthcare services. Before getting into the details of billing and payment in healthcare, we will look into typical healthcare models across the world. We can divide these into two main ones: the European Scandinavian one, which is set at a national level where the state controls the various services and these are available to all citizens. This model has some advantages. It can provide better preventive care as well as limit costs. However, the services may not be enough and access to more specialized care may be limited. This is why this model is frequently complemented with private healthcare services, which can have their own insurance or be associated to external insurance companies. We also have the American model, which provides services at the time of need, but is not available to all equally, as the costs can be very high. Moreover, emergency treatments that cannot be paid by the patient are paid by other consumer or taxpayers. Usually, the companies offer health insurance to their employees, but if that is not the case, or if a person is not employed, the service needs to be paid privately. Billing and payment for healthcare services comprise an essential part of the healthcare domain. Efficient and cost-effective payments can support the continuity of the system and provide for services and procedures optimization. In order to receive payment for the services, healthcare providers need to submit their claims to insurance companies, or as in the case of the US, this can also be done via clearinghouses that generate the appropriate format to standardize and speed those claims. When a payment is approved, the providers may receive information regarding transaction details via an explanation of benefits or an electronic remittance advice. From the patient side, there are usually three main options of payments: a co-pay situation, where the patient pays out of pocket for the expenses; a deductible option, where the patient pays until a specific deductible is met, usually defined by the insurance company; or a third option, co-insurance, where the patient pays a predefined percentage. Also, for the healthcare providers, there are different models of payment. These are examples from the US, but can also be found around the world. One model is fee for service, where the provider is paid in total after providing the service. This is the most commonly used method, but it can make providers focus on the amount of services provided rather than their quality. It is a model that frequently complements the capitation model. In the capitation model, the providers are registered in a network or a plan and are paid a predefined flat fee. This may be cost-effective when subscription to the plan is balanced, but if some providers get oversubscribed in detriment of others, this can create delayed access to services. The third model of payment is with a fixed salary paid on a weekly or monthly basis, independently of the number of patients they treat. In this case, there is no real incentive for the providers to see more patients and improve their performance. The problem regarding the oversubscription of specific providers also applies here. Now, just a brief history regarding insurance in US. Both the Medicare and Medicaid insurer systems were set in 1965, and while the former focused on supporting people with more than 65 years old, long-term disabled or eligible by Social Security Administration, the latter focused also on the indigent, so families with dependent children, the elderly, disabled, and so on. In the decades of the 80s and the 90s, the health maintenance organizations were set in order to contain the costs associated with healthcare services, but this was more effective after 1983, when Medicare associated the payments to providers with the diagnosis related groups. This means that the provided services were codified and grouped in a standardized way, and this allowed for a more efficient control of payments and use of organization resources. Currently, there are different types of insurance organizations, like the HMOs, health maintenance organizations, which include hospitals, physician offices, and other insurance plans, and commonly use the fee for service payment model. Also available are the PPOs, so preferred provider organizations, which consist of a network of hospitals and physicians and they commonly use the capitation payment model. Finally, there is also a combination of both, so HMOs plus PPOs, which are also called POS. A different paradigm that was introduced in US in 2009 was the Affordable Healthcare for America Act, commonly known as Obamacare. This added to the previous models of billing and payment in healthcare the possibility of individuals to enroll in private health insurance plans. This allowed for more opportunities of healthcare treatment to a wider and more diverse population, where resources could be shared and costs could be more contained. From the various healthcare organizations and procedures already mentioned, it is also important to realize that other indirect health providers can have an important impact on the provision of efficient and effective health services. One example among these indirect healthcare providers is clinical research organizations or units. Clinical research may need to manage and process a lot of data for long periods of time in, for example, clinical trials. If any disruption happens in any part of the trial, this can affect the different stages of the trial and even compromise and halt the whole process, with serious impact on healthcare procedures, including the development of new drugs and treatments. Another important component of the healthcare industry are external third parties. From pharmaceutical companies to software medical devices providers, the healthcare domain relies on external organizations to provide and complement many of their daily services. However, the more decentralized and wider is the ecosystem, the more difficult it is to control and protect. There are several issues to take into account as a healthcare cybersecurity professional. It is very important to understand if the main organization is insured against third parties' liability and loss, what kinds of business agreements or contracts have been made, and what legislation needs to be taken into account. Moreover, in terms of multinational organizations, we may also need to take into account different and at times conflicting international laws, and managing liability in this context can become very complex. Healthcare providers may, however, benefit from what third parties have to offer. Solution providers can be a cost effective way for healthcare organizations to transfer risk. From hosting services to encryption or audit solutions, it is crucial for a healthcare security professional to understand the products and services needed to face healthcare threats and mitigate risks. So, in this video, we looked into the healthcare domain, some of its key challenges, and the main organizations and providers that make healthcare the complex but much needed sector in our societies. The key takeaways for a healthcare security professional are: learn your health environment very well, what types of organizations it integrates, what roles, what are the main vulnerabilities and risks, and what is possible to do with them. And be sure to know the applicable legislation and regulations that you may need to be dealing with. Finally, the relation with third parties must not be disregarded, as commonly threats can be exploited via these organizations. Closely understanding and dealing with these relations can be key to avoid problems in the long term. In the next video of Section 1, we will be looking at health data management, workflow, and infrastructures. Thank you and see you next time.